I thank you, Joe, and I thank Senator Schumer and Senator Murray, Senator Shaheen. What you're seeing here right now is the beginning of a big national debate over the responsibilities of Washington, D.C. to help every state, every town, every city, every village in America to fight this epidemic. The terrorist call, which families are now afraid to get, is not from something overseas. It's the call to tell them that another member of their family has now been hit by this opioid, heroin epidemic in America. Knows no racial boundaries, income boundaries, state boundaries. This is the fight of our times. All of us know what an epidemic looks like. Drug overdoses now claim more lives than motor vehicle accidents or gun violence. That's today in America. And the trend is straight upwards. The United States is less than 5% of the population of the world, but we consume 80% of the world's opioid painkillers. That must end. Last year, nearly 30,000 Americans died of an opioid overdose. More than 1,300 of those were from my home state of Massachusetts. In the city of Brockton, Massachusetts, in January, in the span of 48 hours, 40 people overdosed on opioids. Between 2000 and 2013, the rate of death from heroin overdoses nearly quadrupled in the United States of America. 13 years, a quadrupling of overdoses. I'm hearing enormous frustration from people who don't feel the resources are being brought to bear to tackle this enormous crisis. Now, let's compare what we did as a nation when confronted with other deadly epidemics. A bipartisan majority of Congress funded more than $5 billion to respond to Ebola. We should have. We dispatched the medical community and the public health experts. We built entire facilities to ensure that we stop the spread of that deadly virus. Today, the Obama administration is asking Congress for $1.8 billion in emergency funding to fight the Zika virus. We should do that. Imagine, however, if we applied the same commitment, the same urgency, the same level of resources to the prescription drug and heroin epidemic. We need an immediate and comprehensive strategy that requires commitment from all levels of government, local, state, federal, and that means Congress must step up and respond with leadership and with the resources. We need to stop the overprescription of opioid pain medications. We must prevent addiction before it takes hold. And we must provide the funding necessary to ensure we stem this tide of deadly addiction. That's what Jean Shaheen is talking about. That's what Patty is talking about. That's what Chuck and Joe are talking about. Stopping the overprescription of pain medication that is fueling opioid addiction and overdoses starts with the prescribers. First, we need to require anyone who prescribes opioid pain medication and other controlled substances to undergo mandatory training on safe prescribing practices and the identification of possible substance use disorders. Senator Blumenthal was going to make that amendment in the Judiciary Committee today. Senator Blumenthal and I had an amendment that he was going to make. He was asked not to make that amendment before the floor. We have to have the debate on that amendment on the floor of the United States Senate on prescriber education. That amendment must be debated. Second, the Food and Drug Administration must change its decision not to seek expert advice about the risk of addiction before it approves abuse-deterrent opioids. Abuse-deterrent opioids is an oxymoron. Whether an opioid is abuse-deterrent or not hasn't prevented tens of thousands of people who have had their wisdom teeth removed or experienced lower back pain from getting addicted to these painkillers. By refusing to convene advisory committees to inform all of its opioid approval decisions, the FDA continues to ignore outside experts who could help stem the tide of tragic deaths and overdoses plaguing this country. Now is the time to implement effective and common sense solutions. We need to destigmatize, not criminalize, drug abuse. We need more education, not incarceration. But we need the funding to do that. Funding for families, funding for treatment providers, funding for our sheriffs and firefighters who carry the overdose prevention drugs that save lives. Funding for the public education campaigns so that we can prevent addiction before it takes hold. The legislation that passed out of the Judiciary Committee today is a good first step. But we need to go much, much farther. It doesn't provide the real resources necessary to address a crisis that is only growing in numbers and severity. Without real funding, this effort is a mere Band-Aid when we need a tourniquet. And that comes in the form of emergency funding. We are hemorrhaging lives by the day, and supplemental funding is the first step needed to staunch the flow of suffering and death. This epidemic of prescription drug and heroin overdoses knows no geographic boundaries. We have to work together on a bipartisan basis in order to provide the funding for these local heroes who right now do not have the resources to be able to do that. And here in Washington, we have to provide the leadership in order to make this the national emergency, which we know it to be, with the solutions that all Americans are crying out for. So we thank all of our leaders here. This is the beginning of a huge debate.